Thank you very much. Good morning, everyone. Disclosures. So mechanical complications remain the most common and least understood complications following adult spinal deformity surgery. And for years, we've been trying to understand what is predicting mechanical complications, and we have used parameters obtained from X-rays, either isolated parameters or scores. Radiomics nowadays is a technique which employs machine learning and extracts quantitative features from processed radiographic images, and it holds promise for improving clinical prediction models. And radiomics takes the full picture, not just single parameters. So our hypothesis was that processed image algorithms would outperform traditional radiographic measurements in predicting postoperative mechanical complications in adult spinal deformity. So for this, we did a retrospective study, including prospectively collected data from an ASD multicentric international database. The inclusion criteria for this study were having complete surgical, clinical, and radiographic baseline, 6 weeks, and 2-year follow-up data. 690 patients were accomplishing inclusion criteria. 81 of them were females. 18.6 had a 3-column osteotomy. 43% of them had been fixed down to the pelvis, and 24% of them had a major mechanical complication during follow-up. So what we did is we just processed full spine standing radiographic images, and we analyzed them using an automatic vertebral centroid generation algorithm which map posterior-anterior and lateral spinal shape. Then we got angles and distances between each vertebral centroid and the pelvic centroid, and this was automatically obtained. We then did some machine learning models using CAD-boost and iterative variable reduction, and the variables that we included in the models were the non-radiographic parameters that are always needed, demographic, PROMs, and surgical, the traditional radiographic measurements that we commented previously, all the single isolated coronal or sagittal parameters you could imagine, and the gap score. And then we had another set of variables which were the processed image features, and mainly we were using angular parameters. We compared the different models using the area under the ROC, sensitivity, specificity, and the Breyer score. And after that, we used SHAP values to assess the variable contribution, to weight the contribution of each variable, also to address overfitting, and to perform an iterative variable reduction to have better models. So here are the results, and not surprisingly, processed images. So it's the full radiograph plus non-radiographic parameters, which means demographic and PROMs, clearly outperformed the gold standard we are using now, including traditional radiographic measurements plus non-radiographic parameters. You can see in the green line the processed image model, and in the orange line, the most gold standard. When we added traditional radiographic measurements to these processed images models, we did not improve model estimates, so this is not providing any added value. Then we checked for the value of each parameters, and we saw that processed images display the majority of the SHAP contribution to prediction for any model they participated in. And we also could see the interaction between the variables, and processed images show the stronger pairwise interaction with other variables, showing the relevance of these variables. Then personalized SHAP decision plots could also identify which were the most critical centroids that were associated with the risk of mechanical complications. Both globally, you could have a mean value, which is the most relevant centroid, and also individually for each patient. So as a conclusion, compared to traditional radiographic measurements, radiomics powered by full spine processed radiographic images enable the most accurate predictive models for mechanical complications in adult spinal deformity. Processed radiographic images are key drivers of the prediction, paired with non-radiographic variables, which are surgical, PROMs, and demographic, in a multidimensional pathology. This is why we need also these parameters. And finally, radiomic models can potentially identify for each patient which are the critical centroids, increasing the risk of mechanical complications, and therefore they should offer clinicians a powerful and time-efficient tool for personalized surgical planning, ultimately enhancing ASD surgical outcomes. Thank you very much for your attention.